The Mecklenburg County ABC Law Enforcement Division provides a free training program to ABC permitted establishments called the Alcohol Seller and Server Excellence Training to educate employees on the possession and sale of alcohol. This ABC officer training covers underage sales, forms of acceptable identification, and employee age requirements. The Mecklenburg County ABC Board, more than a bottle.
Hi, I'm Melanie Pratt, your midday host for Praise 100.9. Welcome to Radio 1 Charlotte's Community Health Series in partnership with the Mecklenburg County Alcoholic Beverage and Control Board. This will be a space where you will find hope, resources, and assistance. Each month, we'll discuss a topic for you, our listeners, that can affect your overall mental and behavioral health. So for this month, our topic is barriers to treatment for mental health. And to provide us with the toolbox needed to navigate, we have not one, but two amazing organizations coming together. In no particular order, the first organization is the C.W. Williams Community Health Center with Ms. Deborah Weeks, Chief Executive Officer, and Ms. Benjinas Jenkins, Behavioral Health Director. And the second organization is Carolina's Care with Ms. Patrice Brown, Program Director. Welcome, ladies. How are you doing today? Thanks so much for joining me for Community Mental Health, sponsored by Mecklenburg County ABC Board. How are you doing?
Good. Thank you for having us.
Thank you.
Thanks so much for being with us. Now, Ms. Weeks, we're going to start with you. So thank you again for being with us today for our mental and behavioral health initiative, Community Mental Health, where this month, of course, we're focusing on barriers to treatment for mental health. It's a subject discussed and some progress has been made. But can you please tell us about your organization, the C.W. Williams Community Health Center?
Absolutely. And thank you for having me today, Ms. Pratt. We so appreciate you and this audience because it is such a prevalent issue, particularly in Charlotte. When you look at Charlotte today, you see many more homeless people than you've ever seen, most of whom are right now on the street, have mental illness, and we try to help where we can. C.W. Williams is very fortunate to have a grant, not only with Meck County ABC, but also with her Resources Services Administration, where we can expand our services to the mentally ill and people who just need case management, some reassurance, just counseling. That's very important. We don't need to always wait until it's progressed beyond to the point where it needs residential treatment. My concern is I've been here now in Charlotte since 2015. In 2018, I believe, maybe 2019, we held a mental health symposium. We asked for help from the state. Our now Secretaries of State did attend. The biggest, I believe the biggest thorn in all of our sides is that there is no financial support, not just to our agencies, but to the issues at hand, long-term residential care, making sure that we can pay people what they are worth, what their value is, so that they can provide the intervention needed, so that there are support services available on multiple levels for multiple types of services. We also see a huge deficit in child welfare when it comes to the children who require mental health intervention, sexual assault, and what that means, and helping to heal the child and family. We don't have those services available for the growth we see in the city.
Indeed, and we thank you and your organization for the work that you do, and we're going to dig more into that. Ms. Brown, I'll ask the same of you. Can you please provide our audience with an overview about Carolina Cares?
Yes, so Carolina's Care Partnership, we serve a variety amount of programs within Carolina's Care. So Carolina's Care is the umbrella, and right underneath it, we have our housing, we have mental health services, peer support, substance use prevention, and within the organization as a whole, we have case managers who work with clients who are HIV positive. And so we provide housing services to all those clients. We serve clients who are HIV positive, the LGBTQ plus community, and youth and young adults. And so we overall just try to serve and work with them holistically to help with their health and well-being. Not only providing housing, but also providing linkage to care, making sure that they're connected with their primary care doctor, taking their medication, and overall find sustainable housing for them.
So much you all cover, and we thank you so much for that. We know that mental health is kind of a hot button, even a buzzword. Thankfully, there's lots of conversation going on around the topic. However, there still exist significant barriers to treatment. Ms. Brown, can you share with us some of those barriers as it relates to mental health?
Ooh, some of those barriers.
Yeah.
There is quite a few barriers to mental health. But some of those barriers include financial issues, lack of providers, discrimination, stigma. One of the biggest things also that I don't think we pay attention to is language. That is a barrier to mental health, which is if we cannot communicate with the person that needs that care, it causes a lapse in care because we don't know how to communicate with them. Me, I'm from Jamaica. So that communication also, that's a barrier.
Yes. Ms. Jenkins, can you share with us some ways we might go about breaking these barriers, as many and as ominous as they are?
Yes. And, thank you, Ms. Brown. She mentioned some of those barriers, and we know that those barriers are not new. She mentioned about costs and stigma and language. Some of the ways I would say that we can help break those barriers, one would be through education. Let's change and reframe the narrative around mental health in our community. So we need to know mental health is a psychological state of well-being.
Yes.
It is vital to every part of who we are. So it's important. So when we talk about the barrier of cost, finding integrated services and communities where patients and communities can find resources to find affordable services. That's important. Ms. Weeks mentioned about having grants and finding, just getting people connected to those resources. Another one would be language, making sure that we could hire providers who are bilingual, that can assist in certain populations. That's another way that we could help with those barriers. There was stigma. Again, that's why education is so important to reframe how we see mental health. A lot of stigma around our communities of color when we're working with LGBTQ plus communities. When we think about the HIV community that Ms. Brown mentioned, it is so important that we are culturally sensitive and we are affirming care. So that's another way. So I can go on and add on to Ms. Brown's list, and I'm sure because there are just so many things that we could really talk about. So access is so important, and making sure that our community can navigate the systems and how to find those services that they need to help with their mental health.
Ms. Weeks, can you talk a little bit more about the stigmas we face with mental health care and some of the social determinants of mental health and how it affects our individual emotional and psychiatric health?
Oh, absolutely. And as they've already mentioned, the stigma is not new. All of these barriers to care is not new. This is going back years and years. I have to tell you, before I came to North Carolina, I was in Florida. And in Florida, I made mention at a church that we have to destigmatize by first accepting the language, by first accepting and understanding exactly what Ms. Jenkins shared. It's a psychological state of well-being. What does that mean? It means sometimes we experience stressors in life. What do those stressors do? They make us incapable of functioning often. What does that mean? I can't take care of what's necessary for the right now. Sometimes we need help navigating through that so that we can get to the day-to-day task. And when you go without assistance, when you go without help, what do you create? More, and more stress. Fortunately, with C.W. Williams Community Health Center, in language barriers and stigma, we have those um, excellent staff, excellent communicators, and we also have a system that we utilize in case we do not speak your language. We know we have people who speak English and Spanish, but that doesn't mean anything. We just did a mock for our new building, and in that mock, people were speaking in other languages and other dialects. Somebody played the Rastafari who's coming into the center, and someone else played a Spanish woman who was drug addicted. Somebody else played, and thus and so. And it allowed us to see the language that Miss Brown was speaking of. You can say one word to someone who's Jamaican and another word to someone who's American. It does not mean the same thing. So how we communicate, that we communicate with their understanding, does make a difference. That we don't offend, that we can embrace that cultural value, that we can understand where they may be, not scorn them if they are homeless, because that's another thing. They may not come in looking like the average everyday person or smelling like the average. Does that mean that they receive a different service? It should not. Anywhere they are, they should get the same respect of anyone else. And I think that's the difference with federally qualified health centers. We understand no matter where you are, just like in social work 101, we meet you at that place. We do not take it for granted that we're human beings first.
I love that. Communication is so important, as is community. And Ms. Weeks, you mentioned having this conversation in church, and it's important for us to conquer these issues in community. Ms. Brown, can you elaborate a little bit more and discuss how important community and peer support is in supporting people struggling with substance use or mental health?
So peer support is incredibly very important to a person's recovery, including the community. We need to meet people where they are. 100%, we've got to meet them where they are. As Ms. Weeks said, if they smell differently, does that disqualify someone? No. So us stepping outside of ourselves and meeting them wherever they are and showing them that compassion, that empathy. And that is what a peer support does. Peer support, they utilize their shared experiences. And so that is how important peer support is. Their lived experience, oh my gosh, it makes them more relatable. They are relatable wholly on that lived experience, understanding the challenges that each other faces. Peer support, they also take a holistic view of recovery, that overall well-being. And so with them sharing those relatability, it opens up the conversation for empathetic listening. They encourage each other and they speak the same language. So peer support overall, it's so incredible to that next person because of that relatability.
And I know peer-to-peer often means that those people speak the same language, whether it is experiential language, sometimes it's cultural language, but then there's also generational language. Our children are dealing with so much. Yes. Our children are exposed to so much so soon, and that's whether or not they're in a dysfunctional family environment. Our children are just exposed to so much. Ms. Jenkins, can you share with us some more about serving the children in our communities that need support for their mental health, or for members of their, sometimes it's people in their family that are having the issue, but the children need the support there?
Yes, one of my favorite quotes is from Lucille Clifton. And it says, children need mirrors in which they see themselves and windows in which to see the world. Mm-hmm. So with that, it's just so important, the environment our children are in. So it's important that we make sure that their families, their caregivers are well, mentally, physically, that they're getting the care that they need, the caregivers, in order to know how to function and help their children. Because that's what they see. That's what the kids are seeing. A lot of times our children don't get to decompress until they go to school. And then it looks like it's a behavioral issue, but it's really getting to the root of what's going on in their homes. What are their environments? Is there substance abuse there? Is there mental health there? Is there an ill parent there? So it's very important to take care of the system, the whole family, to
Yeah.
make sure our kids are well. You know, there's a lot of work around ACEs. So we want to make sure that those parents or caregivers' trauma don't become those children trauma. So it's just so important to make sure that we address these barriers, meet in the community, you know, where they are, and making sure that the resources and services are accessible to all the families, regardless of what they're facing, language-wise, homelessness, substance abuse, just meeting them where they are, because it's very important to make sure that those traumas don't transfer over into the children.
Absolutely. Thank you so much for that. These issues are so complex, which is why there's a need for each and every organization that fits in, you know, their pocket, their area of expertise. Ms. Brown, I would like to go around and have each of you leave us with a closing nugget that we can talk about in terms of coping skills as we face barriers to treatment and some area that we might all maybe be able to help. Ms. Brown, I'd like to start with you and then go to Ms. Weeks.
I always say, and I said that before, we need to meet people where they are, meet them with some compassion and empathy, and listen. They are speaking. We need to listen to what they're saying, what's going on, and understand their path, their struggle, and just be there for them. Be there for them as a whole person. Come as we are and meet them where they are.
And can you tell us how we can keep up with you and your organization as well?
Yes. So Carolina's Care Partnership, we are located at 5855 Executive Center Drive, Suite 200. And we are on social media, all forms of social media. We're also on LinkedIn. And I can leave my phone number as well, where we can be contacted, which is 704-804-2624.
Thank you so much. Ms. Weeks, you're up next. What would you leave us with?
I think we take for granted that it is often that child. I was so happy to hear you all discuss the children, because that child, we take for granted the safe space that we were in as children. The stressors exist even in the schools today. So we go even to the schools. And I'm fortunate enough to have Ms. Jenkins and her team to be able to go out and about to the schools, to wherever the patients are. We have mobile units, we have medical units, dental units, and I'm proud to say, because of the funding from HRSA, we will soon have a behavioral health unit that can go out to the communities, out to the rural areas, out to the school systems and meet with children. We have to do some legislative lobbying. We have to get the people to allow us to get into the schools to treat the children without all these barriers that is created. A lot of the kids come, yes, from home with stress because whatever's going on at home, but then they come to school, they have to go through metal bars. They have to be trained what to do in case there's a gun violence. There are so many stressors that children receive today. We must as adults be cognizant, be protective, and provide them the support, the care, and the love that they are begging us to give them, the protection that they need so that they don't carry that trauma, as Ms. Jenkins says, into their adult lives and becomes dysfunctional adults raising dysfunctional children because of unhealed pain. We must recognize that today. What we can do is to be available. What we can do is to listen. What we can do is to secure funding so that we can have these various tools in order to relate to the children, because sometimes they don't have the words to speak. So how else do they speak? Through interaction, through play, through, dolls. We must learn those mechanisms, how to best relate to children. Sometimes in whether or not they have a meal, We have a new nutrition kitchen in our new location, our renewed location at 3333. We want to train the parent and the adult how to feed those children and have healthy minds because they're not hungry at school. We want to be able to incorporate some wellness and wholeness that is not always the medical first. Sometimes there are those other issues, social determinants of health that we have to address. And that mental health stability is key. How do we help? Ms. Jenkins is very determined that you cannot help the child without helping the family.
Absolutely.
How do we address that within the whole family? So there's a lot of different layers that we can address it. We need that local level, the community, that, as Ms. Brown so well put it, that continuity of care. How do we continue to work with one another to best relate to the child? Who's doing the lobbying? Who's appealing to our government for whatever it is we need? It's no longer enough to say the state does not have enough money for mental health. We must do something, otherwise it's all going to end up on everyone's doorstep. So we need opportunities such as this too, to be able to say thank you. We would like for us to be able to communicate more cooperatively and get that word out and get the help that we need.
Absolutely. Thank you so much, Ms. Weeks. Ms. Jenkins, any advice or any charge to our community? And tell us how we can keep up with you all at C.W. Williams.
Okay. First, I would say don't make no assumptions. Let's not make assumptions about the people that we serve and the people that are in our community. The children, the families, no assumptions. Be sensitive. You know, the judgments, we don't need any of that. Let's serve, let's help, let's make a difference in the lives of the community. If it's with homelessness, again, HIV, LGBTQ, however we can stand in that gap to help. One of the things I did want to share and mention, telehealth services. We're in a different world since COVID, and it's really expanded within mental health to be able to provide telehealth services. One of the things that I love that what we do here at C.W. Williams is that integrated health system. You know, we're taking care of everybody, the physical and the mental, dentists, you know, just all, Ms. Weeks mentioned nutrition. So collaborating with organizations like Ms. Brown. So that is just really, really important. Where you can reach us? Well, we are going back home to 3333 Wilkinson Boulevard. This is a home location, new building, but it's still home. We also have our location at 5800 Old Pineville Road. We could be reached there. So our phone number is, don't know by heart. So the phone number is 704-393-7720. And we have an awesome team just waiting to receive. We have a call center now. So we are ready to receive the community and get everyone connected to those awesome integrated services that we have here at C.W. Williams Community Health Center. So just thank you. Thank you for this opportunity. And let's just keep mental health in the forefront because it's vital to every part of our well-being.
Ms. Pratt, might I add that?
Absolutely.
We are also on social media, various platforms. We have a number that, for me, is easy to remember. I hope it is for everyone in the audience. And that is 866-CWW-4U. That's 866-CWW-4, the number 4, U. And we are so very grateful to you, Ms. Pratt, and thank you for affording us the opportunity to meet together, speak about this very important topic, and be hosted by such an elegant, well-spoken individual. Thank you so very much.
Thank you to each of you, Ms. Weeks, Ms. Jenkins, Ms. Brown. And we are so grateful that each of you has joined us today. And with that, we're going to close out the series on barriers to treatment. I want to thank each of your organizations, C.W. Williams Community Health Center with Ms. Deborah Weeks, Chief Executive Officer, Ms. Benjina Jenkins, Behavioral Health Director, and Carolina's Care with Ms. Patrice Brown, Program Director. I hope that all of our listeners take advantage of the resources and information that was shared today. And if you know someone that could benefit from the services provided by the C.W. Williams Community Health Center or Carolina's Care, you can see both of their contact information on the bottom of the screen. We also want to say a special thank you to the Mecklenburg County ABC Board for making all of this possible and providing the community with the means and resources for organizations such as C.W. Williams Community Health Center and Carolina's Care. We have heard it said that it takes a village to raise a child. And in our discussions today, something that came to light for me is that it is those children that in turn become the village. And so it is a vicious cycle and a continuum that we want to be careful and careful with as we together as a community work to put an end to the barriers to treatment and mental health. Thank you all for joining us today. We appreciate you.